For those folks that are in that area, I would say do learn the principles and know how you can apply them. But you want to be very personal and make sure that you're clear on the outcomes of the patient and how you're going to be using this.
Hello, everyone, and welcome to the Strategy of Health podcast from the American Journal of Healthcare Strategy. My name is Cole Lyons, and I'm joined today with Dr. Matthew Montoya, who is the professor of systems science, among many other things, a very long and impressive career history at Johns Hopkins. Dr. Montoya, can you please just introduce yourself and tell us a little bit about what you're working on now and your current role?
Sure, absolutely. Hi, Matt Montoya. Well, I appreciate being on the podcast, by the way. And so I was thinking about this, and the idea that I've been at Hopkins for 40 years now. So this is my 40th year. I started in the Hopkins family in the mid 80s.
Wow.
And so I've transitioned recently into healthcare systems, but I worked several decades in other areas focusing on health. And so part of what I'm trying to do now is bring the systems science, the systems thinking, systems engineering to healthcare. And that comes in a variety of forms. And one of the great forms is lecturing, working with people who are interested in this, but also then looking at the next level of healthcare systems in terms of introduction to AI and the tools associated with AI and improving processes and outcomes. So that's what I'm currently doing.
And you have an impressive amount of education, and I just wanted to kind of go over some of it here. You have, mathematics, a graduate degree in mathematics and systems engineering, as well as a doctorate in systems engineering, a master's in public health, and a master's in business administration. I have to ask, what caused you to get this amount of education?
And so part of what I think about is early on in my life, and I don't want to get too far into this, but early on in my life, I was always very kind of eclectic and some version of a Renaissance person. I always liked blending different pieces together. So back in high school, I did well at mathematics and physics, but I also played instruments. I also did sports. So I loved doing all these eclectic things, and zeroing in on something just wasn't in my DNA. And so as I started my college venture, I started in the College of Physics, Natural Sciences, but I didn't want to be bound to that. So I had an applied physics degree, which led me to engineering and other mechanical and electrical engineering, as well as I found that I could get a minor in mathematics. So I did all that in my undergrad. And so as I continued on my journey, I learned that as I became more acquainted with the concept of systems, it started with systems analysis. I went into more mathematics background, as well as zeroed in on systems engineering. Eventually, started doing more business aspects as I started getting involved in more of the management of larger portfolios. And then eventually, as I'd mentioned, as I'm in health now, I wanted to be more aware of, say, healthcare thinking and then all the context of healthcare. So I decided to get an MPH as well. So it's kind of part of my DNA, how I solve problems, how I attack problems. And I love looking at larger contexts and solving the problems that make sure that stakeholders and other factors are involved.
And I appreciate that a lot personally, because I also feel like in order to kind of solve problems, you do have to have a pretty solid understanding of kind of the periphery and what's happening around that. And we've discussed that actually in systems engineering class that I'm taking with you, which is you have to, as a systems engineer, understand a bit of these different disciplines that's happening. One of the first questions I wanted to ask you, though, is why systems engineering? Because even with your engineering background and the kind of healthcare degrees and business degrees, there's a lot of executives who have that background. There's a lot of public health workers and public health officials who have that background. So it feels like something had to have been special about systems engineering for you to want to kind of delve and kind of practice in that area. So what about it struck that kind of spark for you?
Sure, I appreciate that. For me, the idea of the larger problem solving, again, part of my DNA is I did not want to get locked into working on one specific problem. And so as I looked at solving problems, I found that as those focus areas touch other areas, I was able to contribute and provide more value to the organization, as well as provide more insights to the problem. And so as I think about this, and I just think of my journey in systems engineering, it came in a sense somewhat naturally. And I think of as I look at problems, the idea of looking at and we've talked about this in class, the idea of endpoints, context, the roadmap to solving problems. And I think my value and contributions at APL as well as Hopkins over the years has been able to dive into different problems and solve them where they're very complex. Because as you dive into a problem, and a lot of people experience it, it's just a cloudy mess of confusion and people, asking for things. And so clarity. And so part of my DNA is creating clarity out of chaos. And so systems engineering is a tool that allowed to do that. Electrical engineering, mechanical, and other these special areas allow you to focus, but bringing clarity to a problem and providing outcomes. And specifically within healthcare, outcomes are such an important piece, and so many different elements within healthcare. And again, same kind of thing. So many areas that are kind of talking and trying to bring focus, but you have to bring the clarity to the overall problem, patient output, or tools provided to the clinician or whomever.
I know that in a lot of healthcare organizations, that clarity of communication is really something that they're still kind of developing and struggling with. Sometimes things that have already been solved in the business world are still not really solved in the healthcare business world. And I think that's with good reason. I wanted to kind of ask then, what are some examples of whether it's work you've done or work that you've seen when it comes to systems engineering that has benefited a clinical outcome or healthcare? Like what are some examples of this that the
Sure.
audience can relate to?
Yeah, and I'll give a little bit of context to my answer here, which is as you think through the systems engineering, and I'll call it the life cycle, when a product or a capability or a process is being generated, there's a sequence that you will go through in order to generate that. And so part of what I've done over the years is be able to kind of plot myself in the middle of that context. It could be at the beginning of the problem, the end of the problem, the middle of the problem, and be able to kind of work my way through all the elements. And so I've worked on some defense-related health as well as private health, but I'll pick on a specific defense-related health area where part of what we were doing is coming up with and I'll just use kind of a generic term, kind of a crash test dummy, generically speaking. There's more technical terms than that. But part of what we were trying to do is develop a more accurate version of that for a division within the Department of Defense. And so within our organization, they really struggled bringing all the pieces together. We had easily a dozen subcontractors. They were university performers, we called them, and they were from top-notch universities across the country. And what we were trying to do is bring that capability to realization for DoD. And so I had gained a reputation within JHU to solve these larger problems. So they approached me to be able to jump into this team and be able to do that. I had limited to zero experience in this particular area, but they knew I could solve large, complex problems. And so jumping into this problem, I was in the middle of it. They had kind of put some concepts together. They had worked with their university performers, and they developed some technical capabilities. But my job was to bring it all together. So I had to think through in terms that are in the vernacular systems engineering, think through the architecture of what the problem was going to be, think through the measures and metrics that actually mattered associated with this particular capability. I like to think of the outcomes, what kind of outcomes needed to happen, and that can be in terms of product, or it could be in terms of analysis or reports. And so I had to create this architecture with the performers, with my internal team. In a sense, it's kind of like building the bridge as you're moving across it. And so being able to look at the ideas of requirements, looking at the idea of creating measures and metrics and how they all fit together so that you can create this one um, capability brought to me, I've done lots of things over the years, but this really crystallized the ability of a systems person to jump into any problem, even if they have limited technical background in that particular specialty area, and be able to create a structure to it, bring clarity to it, create a roadmap, create touch points, clarify metrics and drive that capability to the end. Because a lot of this is orchestration. That's some of the terms that we use in systems. Is you're creating this, you're orchestrating all these performers and outputs and capabilities, and it's not for the faint of heart. Let me
Yeah.
tell you, because as you go through this process, there's a lot of people kind of nipping at your heels, and sponsors and other customers, giving you an earful of
Right.
things, and so you really have to keep your head as you're moving through this. But that, to me, within the healthcare arena, was one of the more interesting and really stressing the system's capabilities to be able to drive something like that. And it was a successful outcome.
Good.
And I probably did some accelerated aging at that point in my life
It's
from
terrible.
that endeavor.
So some of the questions I think, especially at the executive level, as health systems are getting more bigger and complicated, right? People are wondering how to avoid running into these issues where you have kind of some really intelligent, some of the best people, but they're not operating as efficiently. They're not actually solving the problems because of a lack of this kind of cohesion. The question that might come up from executives is, what is the difference between systems engineering and really good, project management?
Yeah,
How do you separate those two
yeah,
things?
and the way that I look at it, that they're inseparable, because the project management, I view that as the I'll say the process and product mechanics, which is budget, schedule, maybe resource allocation. Where the systems engineering is, you're working on the technical aspect, but that's so important to link into the resources. If there's risks associated with it, you have to work with the project management. If there's technical resources that you need to work with the project manager. So they're linked together. However, the idea of how do you accomplish this technically, healthcare is one of the more difficult areas, because this has been going on for decades, if not centuries in some cases, where people are incentivized and specialized. And so people come in and they're especially in cardiac or especially in something else. And so they're incentivized in these particular specialty areas. And so if you come in with the systems mindset, trying to have an outcome in a more of an integrated outcome, that is a difficult barrier to overcome. And so part of what I look at is there has to be, and I use the term a pilot effort, kind of a smaller effort, to get these kind of concepts over. So part of what I think through, maybe there's a specific outcome that people are interested in, and I will say a patient outcome. And so maybe there's two or three specialty areas that play into that outcome. And so you can do a pilot effort with these concepts. And I've used the term already: architectures, metrics, kind of process outcomes,
Yep.
and work through kind of a smaller effort to see, can I create this systems ecosystem at a smaller level and deliver some of the outcomes that I expect, as opposed to trying to eat the whole elephant at once, which has, you may have a hospital and you have, 87 different specialties, and you're trying to do it all at once. So if you can create these key principles that I'm describing, do it on a smaller pilot effort and check the outcomes. And that's part of what is, and you've heard the term Six Sigma, and that's something that they do, is they'll look at the outcomes and they'll check the metrics associated with it. But creating that overall ecosystem and architecture and a process approach goes beyond just a kind of a Six Sigma thing here. And this allows you to create a more enduring ecosystem, try it at a smaller level, and then expand it to other areas as you're able to. But trying to orchestrate all these things all at once at an executive level, that's undoable. And a lot of times when you have a top-down push, there's a lot of resistance from the people who are actually working. So you have to be very careful how you do this. Kind of work a top-down concept, but then do a lower level pilot to try it out. And then once that pilot works, assuming it works, hopefully it works, then that word of mouth from those folks can carry on to others, which again, I've seen that happen on many occasions.
I've found, because I have my green belt in Six Sigma, and I've mostly made it through my black belt, and I've done some project management work. And what I found with the systems engineering, even in just this first course, is when you talk about the technical aspects compared to the financial and the management aspects, you're getting really technical, right? We're not. I think in project management or in Six Sigma, you do sometimes track inputs and outputs, but this goes really beyond that to actually looking at the components and the functions of those components and also how they interact and move that data.
Yes.
My question is, why isn't that already being done as a standard place? Why are you getting called in at the middle or the end, right? Why isn't it like a standard thing from the beginning of all the
Yeah.
projects?
Yeah. And that's common. And, it's the good and the bad where, I've loved helping people and fixing things. But part of what I love to do is create and carry this message because part of what happens in problem solving is people want to rush to the end. And we've talked about this during some of our lectures is people will say, I have an itch. So here's a widget that's going to, address the itch. Where really you want to start creating through a more repeatable process because if you just bought the one widget and then it's not repeatable and you can't figure out how I'm going to create another buy another widget for whatever reason, you have only solved one. It's like a whack-a-mole thing. So what you want to do is create more of an enduring process. And so part of what we're doing in our healthcare systems engineering program is bringing these concepts of systems problem solving to healthcare. And just like I mentioned in the pilot effort, so it's like one one organization or one
Yeah.
student or one effort at a time because you can't do it all at once. And so part of our message is solve, be very clear on what your problem statement is. Be very clear on what your need is because so many times people think they need something and at the end state they realize that's not really what I needed. And so spend a lot of time in the clarity of the problem statement and then the context of the problem. And then what the way I like to solve problems is do that beginning point and then the end point. What are my outcomes? What are my measures and metrics? And then you build this bridge between the two and then these processes that you're describing and the detailed technical pieces, those are the tools that we provide the students so that they know how to build that bridge as they start crossing it.
When it comes to what you're saying, which is, we got to start with one student, one small project, one hospital. What do you see the future as being when it comes to, we have AI, which is going to change a lot of things. But at the same time, you have these huge systems like Advocate Health, which have 40 hospitals
Yeah,
and 5,000 offices, these
yeah,
crazy amounts of things.
yeah.
That is a kind of a system of a system. So where do you see the future of the profession going when it comes to both AI and these larger kind of almost monopolistic systems, these huge systems?
Yeah, and unfortunately, I've seen and lived and experienced some of these things, not only as a systems engineer but also as a patient. I've been through these things and I've seen some of the drawbacks of some of these. And so I'll address the AI question first, and then I'll get into the larger ecosystem question. And so as people become aware of AI, and it sounds very kind of scary, or people aren't quite sure what it is. Um, as I've worked in that area for a number of years, and my math background really kind of is the basis for that, which is there's algorithms and there's algorithms are the basis for problem solving. And so these AI tools are tools to help you solve problems. And so the whole context of systems engineering is solving problems. And so these AI tools, through their mathematical algorithms, and I use the term crowdsourcing, they're giving all kinds of, people are providing all these informations in them. You can solve much more, many more problems as well as a more complex problem. And you just have to use the right tool in the right arena because, and if you've worked with AI at all, sometimes they can give you absolutely completely wrong answers. So you have to be very careful how you
Yeah.
employ these things. So there's a lot of practice and learning by the algorithms. So know that that can work at a micro level. You're looking for some protein characterization at a very low level, as well as you're trying to think through what process should I put together for this organization in order to be more efficient. So these AI algorithms can help you do that. And so as you think through the utilization of AI, I think it's a great tool for a starting point. Don't ever replace it for critical thinking and critical problem solving and asking the right questions, all the things I've mentioned. But I think it's a great start to be able to start framing these things out. What I've noticed as you use these tools, it helps bring people together. One of the things that we like to do in systems engineering, in systems thinking and systems science, is you need to get people on the same page. And so we'll use things like we've talked about before, which is use cases and scenarios where it brings everybody on the same sheet of paper. So if you can have an AI tool that can bring people to better collaborate, you're able to solve the problem and start addressing the problem as a team. Because when you get these top-down executive decisions and they're pushed down and then they don't work well,
Yeah.
part of the problem is that there was not collaboration on the process. People didn't have buy-in. People didn't have a say. And so what you can use these AI tools for is to help bring collaboration and people asking similar questions and then building off something that maybe someone started asking a question through one of these AI tools, and then you can start rendering it further with more people with other questions and start doing it a little bit more collaboratively. But these large organizations and trying to work in a systems context is very difficult.
Yeah.
So I'm always a proponent of, and you'll see me use the term kind of the endpoints for processes, the beginning and the end, and work the bridge. Same thing for putting some type of initiative in place. You can have a top level framework architecture, but you got to work with those that have boots on the ground because they'll have a lot of insights as well as a lot of heuristics and ways that things work and don't work, and you got to then meet in the middle. That's the best way, because if you just do one or the other, if you start at the bottom, you won't necessarily be able to affect the whole organization. If you start on the top, you'll get a lot of resistance, and it won't. One size does not fit all in the process.
So with what you're saying is you can't just have a couple of systems engineers at headquarters pull all of the data, run it through AI. That won't necessarily give you the result. You have to actually have kind of systems engineers being involved
Yeah.
in the each hospital or each of the kind of the actual things that they're trying to look at, right?
Yeah, yeah, and one of the messages I wanted to make sure I said here is the idea of, and I used the word kind of specialist incentive and specialist incentivized. Part of the thing that I think would be important is to have people, as best you can, is be cross trained in different things. And so as you think of systems engineering, if you could have clinical staff have systems training, not just Six Sigma, because that focuses on certain areas, but have more of a systems training, they'll have an appreciation for that. So the idea, you don't have to have a quote employee system engineer at everywhere. You may have a clinical staff who's a lead, but they are conversant in systems processes and efforts, and so they can be the emissary to carry the message. And a lot of times, specifically within healthcare, as a systems engineer comes in, there can be a lot of antibodies as you walk in, and they're like, "Who is this, and what are they going to do?" If you have a clinical staff, we've had nurses, doctors, all kinds of people work through our program, and they carry the weight. If you can show them the system's principles, they can carry these things through. So, as long as you have the system principles somewhere within the organization, and like I say, within healthcare specifically, it can be encapsulated in one of the clinical staff, nurses, whatever. That really carries much more weight.
Well, what does that practically look like? Because that's one of the big questions is people are going to be hearing this and they might be thinking that they need to get to work on implementing systems engineering in their organizations, especially organizations who are undergoing, mergers and acquisitions, or they're doing these big things, or organizations who are solving some of these big problems. So they might want to implement this. What is the most reasonable method? Is it to have staff get their masters in it? Is it a certificate course? What do you recommend?
Yeah, and there's education, and I use OT on the OJT on the job training,
Mm-hmm.
because we'll within the things that we will teach at Hopkins, and there could be certification programs or master's programs. You will learn principles, but it's when you actually take those principles and you have the opportunity to do on the job training, and in some cases you can have within your organization. Um, I'll just call them, we use the term design thinking exercises, where you can actually have people think these things through. You're not actually in an operations context where, people's lives are on the line here, but you have some type of design thinking workshop that you can work these things through. And then after you practice it in that kind of, laboratory setting, so to speak, you can then take it to the on the job. And like I say, I always encourage starting small, making sure it's going to work, because
Yep.
the one size does not fit all. And personalities and how you conduct things do matter. And so learn the skills. Like I say, you use the term certificate. We'll be having a certification program with the healthcare systems, the masters. Many have taken that as well. But then make sure your organization does have these opportunities for design thinking places, sandboxes, some people call them, where you're actually able to think these things through and work them through before you actually take them to the live setting where, literally people's lives are on the line, and make sure that you've thought through how you're going to do these things.
What's the limit with that when it comes to, where is systems engineering applicable? Is it applicable in every clinical specialty? Is it applicable everywhere? When should it be used? When shouldn't it be used?
Mhm. Yeah. So I would say, as you're thinking, and I'm going to put this in like three different categories here. So you think about devices. And so people, when we think about building devices, and so systems engineering, you're trying to build a new device, whatever that may be, very, very applicable in there because you're working through the needs requirements. You're actually building a system. And so very applicable in there from a process standpoint in terms of how do you bring process improvements to an organization, very applicable within there, and making sure that you understand needs, requirements, outcomes, metrics. And then when I'll use the word now, clinical, when you have something very specific where a nurse or a doctor is working very specifically with the patient. And so there you have to be very careful how you apply these things because there's a personalization associated with working with patients. And so there are principles that I think you can use, and then problem solving approaches that you can use in the clinical fashion there. But it's not as clear cut how you use it as the other two areas that I just described. And so for those folks that are in that area, I would say do learn the principles and know how you can apply them. But you want to be very personal and make sure that you're clear on the outcomes of the patient and how you're going to be using those.
Wow. Very good answers to that question. I hope that a lot of people come away from this knowing what some of the first steps are that they can take. One final question: if there's an individual who is interested in getting involved in systems engineering or interested in possibly, brushing up on their skill set, what's a kind of the first step that you'd recommend that they take? What's the first piece of homework you'd give to our listeners?
Okay, and so you mean from a academic standpoint, or just if
Just in
you're
general, if it's a physician or an executive leader and they want to learn more, is there a book you'd recommend or a
huh,
resource you'd recommend to
yeah.
just get them at least more familiarized with the subject?
Yeah, and so one of the books, and there's so many different books, and I used the word earlier, or you used the word earlier, system science, and so that's to me kind of the larger area. But then within there are things called systems thinking, and then systems engineering. So systems science allows you to think through the larger picture. There's systems thinking that allows you to come up with conceptual ways that you view problems, and then systems engineering is the mechanics that we actually go through, which is more what we've been a little bit focusing on. Is how do you now develop processes, capabilities, technical areas, and so if people are interested, to me, I think part of what you're trying to do is get a mindset first, and so systems thinking, I think, is one of those areas. And one of the books I use in my courses all the time is something called The Fifth Discipline, which is a little bit of a business book, but it talks a lot about systems thinking. And so part of what I encourage is making sure you have a sense of the mindset you want to have. And so having the sense of what is interconnectivity, what are relationships, what are dynamics, how do the how do the so how does your push result in some type of outcome, and in some cases it's exactly what you did not expect. And so make sure you have an appreciation for the interconnections, the dynamics, and the unexpected. And then once you do that, you have a sense of how problems is solved in some ways, somehow how things actually function. Then you can, to me, dive in more into the systems engineering mechanics because you have an appreciation for what does it mean? Why am I even looking at it in this context? And now systems engineering allows you to put through these processes and tools and details that we're describing. And so, again, the Fifth Discipline, I think, is a great book. There are many others along those lines, but I think that's a good start.
And I also I've loved that book during our class. It's actually been
Good.
very very interesting because I came out of the MBA and then into this program, and it's been very interesting seeing how that book, The Fifth Discipline, has applied some of the, like you said, the business concepts to system engineering. So for a lot of the individuals watching this who do have their MBA or MHA, I would also very much recommend that book as well. But yeah, thank you so much for coming on, Dr. Montoya. This was a great conversation. I really hope it kind of elucidates this topic at least a little bit for our audience. And I hope that we can have you on again in the future to talk more.
Appreciate it. Thanks for your time.